Okay, welcome back dear friends. I am Dr. Kalim Raza. Today we are going to discuss about visual field pathway. We will discuss in detail that how light basically enters into the eyes through the retina, it enters to your midbrain in pretactile nucleus, and then how this pupillary light reflex works, and how basically this light enters to the occipital lobe also. This is going to be very important lecture. Before moving to the visual field, we have to understand that eyeball, anatomy of the eyeball, this is very important. And out of 12 cranial nerves, 6 of them are like innervating our eyeball. So that's why this is very important organ. And especially if you are dealing with the patient suffering from anopia, temporal anopia or homonymous semianopia, or any injury along the pathway of this optic nerve, because optic nerve is a different nerve, as this is the only nerve, only cranial nerve which is covered by all layers of meninges. So if you are suffering from any tumor that is compressing these intrameningeal spaces, or increase intracranial pressure, or pituitary edema, or you are suffering from cavernous sinus infections, cavernous sinus thrombosis, or carotid cavernous fistula. So it's mean to some extent you will find some kind of clinical presentation around this area also, because all the cranial nerves usually basically which supply to this eyeball region are passing alongside this cavernous sinus through the superiorbital fissure, as we did discussed in like skull lecture. So this is going to be very important lecture. So I will draw and you will stay with me. So suppose we have got two visual field areas, like this is visual field area for the right eye, and here we have got visual field area of the left eye. And on this outer side, suppose this is temporal visual field area, because this is on temporal side. Temporal visual field area, and this is right eye, this is left eye. So light soon it enters through this temporal visual field area. First it's passing to anterior part of the eyes, crossing the lens, and it's going to reflect to the opposite side. So it's cross here. Suppose this is our lens, and eye is also having basically three parts. The anterior part of the eye coat, this is like fibrous part where you have got cornea, the sclera, the lens also. The middle part of eye is having like vitreous tumor. Then inner part of the eye, it's occupying your basically the retinal part, where the ganglion of these ganglionic cells help in formation of the optic nerve. So light from the temporal visual field area, it's moving through the lens, and it's going to strike on the opposite side of the retina. Same on this side also, it's reflecting, and now it's going to become temporal part of the retina. As you can see that this basically the temporal visual field area, this light enters into the eyes through the lens, and it's becoming a nasal part of the retina. You should understand this. And then light from the nasal visual field, as here you can see this is our nasal visual field area. Now from this part, from nasal visual field area, light enters its crosses on opposite side, and now it's going to become temporal part of the retina. So it's mean that temporal visual field area light enters into the eyes and it runs as nasal retina, and nasal visual field area light enters into the eyes and soon it strike on your retina and it's become temporal retina, temporal retina. Then we have to understand that how this optic nerve will travel to your thalamus and to the visual cortex in the occipital lobe. So you have to draw like this. Okay, so here you can see this inside, this is like suppose your nasal retina inside. On the medial side, this is nasal retina, and on outer side this is your temporal retina. And suppose this is left eye and this is your right eye. So the light which is coming from the temporal visual field area, it's going to enter into the opposite side and it continues as now nasal retina. It's on medial side. And it's going to cross to the opposite side and it enters the opposite side of the optic tract. Same from the left side also. Like these fibers are running in optic nerve and this is crossing at this part and this is called as optic chiasma, and from optic chiasma it's going to cross and it's going to pass from the opposite side of the optic tract. So you can see here that this is basically optic nerve. So optic nerve is basically formed by the neurons of this nasal retina and temporal retina. But in nasal retina, this the light is basically coming from the temporal visual field area, as you can see. That's why I am not changing the color. So it's mean that nasal fibers of the optic nerve, they are going to cross at optic chiasma and then they will enter into the opposite side optic tract on the medial side. So you can see this is optic tract, this is optic chiasma, and this is your optic nerve. And this nasal visual field area light enters and it continues as temporal part of optic nerve, and it's not crossing at optic chiasma, it enters to the ipsilateral optic tract. As you can see, it's not crossing. So it's mean basically the light which is coming from the nasal visual field area, it runs as basically temporal part of the retina or temporal part of the optic nerve, and this is basically right optic nerve, as you can see, and these temporal neurons and the temporal a part of the optic nerve, it's running and it's not crossing in optic chiasma, and it's enters the same side of the optic tract, same on the left side also. So it's mean that only the medial side fibers or only the fibers of the nasal retina are going to cross at the optic chiasma, and we do understand that basically fibers of the nasal retina is basically the light which is carried by the nasal retina fibers, the neurons of the nasal retina is carrying the light of the temporal visual field area. So it's mean that temporal visual field area, the temporal visual field neurons are crossing at basically this optic chiasma, which is clinically very important, because this this optic chiasma is immediately located above this sala turcica, and this is a site of pituitary gland also. So you will be having lot of patients suffering from pituitary gland tumors or any other like tumor here, like cavernous sinus thrombosis or infection. It may compress your this part, and people will having visual field defects, especially on bilateral temporal fields, because these fibers are coming from the temporal side. Later we will discuss what is bitemporal hemianopia also. And then now you can see this is optic nerve. Suppose I will label here that this is optic nerve, this is right optic nerve here, and this is your left optic nerve. So this is optic nerve, this is optic nerve, so this is optic nerve here, this one, I suppose this is the optic nerve, and this is optic chiasma. Here this is your optic chiasma, and fibers are crossing at optic chiasma, but only which fibers? Which are running on the medial side, on the nasal part of the retina. So it's mean that nasal part, retinal part of the neuronal part of the optic nerve of the right eye, it continues as basically optic tract fiber of the opposite side, not the ipsilateral side, not the same side. Be careful, please. You should understand this. Then this is your optic tract here. Optic tract, and this is optic nerve, optic chiasma, and this is your optic tract. So you can see now this light basically, so this is like ascending reflex. So light enters to the eyes and it's crossing from the right side, enters to the right side, and from the left side some fibers are crossing at optic chiasma. Then this light is now running in your basically optic tract. So then from the optic tract this light enters into the thalamus, and we know that thalamus is very important relay station. It's a station for all information, sensory information that is coming to your cortex except your smell. So it's mean what is the nucleus where these optic tract fiber are going to synapse? That is the lateral geniculate nucleus of the thalamus, because lateral geniculate nucleus of the thalamus is receiving fibers from this visual field. So this is the lateral geniculate nucleus of thalamus. So this is lateral geniculate nucleus. LGN, lateral geniculate nucleus. So this lateral geniculate nucleus is receiving the light fibers, ascending light fibers through the optic tract, and then these fibers from the optic tract, after synapsing with lateral geniculate nucleus, they enters to the occipital lobe, as optic radiation, and optic radiation fibers will basically terminate in your visual cortex. And where is the basically visual cortex? This visual cortex is basically located in your occipital lobe. So it's your visual cortex. Visual cortex in occipital lobe. So when the light or any image that enters through the retina, through the optic nerve, through the optic chiasm, through the optic tract, after synapsing with the lateral geniculate nucleus, it enters to the cortex. The image is basically like upside down, and it's left, right, reversed. So it's mean who is going to fix this image in proper order? This visual cortex. So you should understand the role of the visual cortex also. So here is optic radiation. This is optic radiation. Optic radiation. And then this is visual cortex in your occipital lobe. And then okay, so how basically when you throw light and when you illuminate basically your eyes, why the pupil will constrict, or when it's like dim light or during the dark, why at the night especially you will see that pupil will dilate, because it's mean that you need more light to basically create any image on basically visual cortex. So you should understand that this is like ascending pathway. This is also called as afferent light reflex pathway. But how pupil will constrict, like that is part of your parasympathetic nervous system. So constriction of pupil, you should understand that is function of parasympathetic nervous system. Dilation of the pupil, this is function of your sympathetic nervous system. And who is going to give you the images in different colors? This is function of like special cells of your retina. Those are called as basically cones. And that basically the fovea is a part of this posterior part of the eye, where you have got this is the highly sensible part. This is also called as fovea centralis, where you have got maximum number of the cones, and where you have got highest visual acuity also. Then you have got one blind spot here also, here where there is no rods and cones. And there are some special cells which are also called as rods, which are sensitive to the light, especially during the night. So if you are having any problem with the rods or the rhodopsin or the retinol, so you have night blindness. Any problem with the cones, you have got color blindness. So this is a vast topic. At this stage, what I just want to give you a concept about this pathway and how basically light travels through the optic nerve, through the optic chiasm, through optic tract, and how it's synapsing with the lateral geniculate nucleus. How your pupillary light reflex works, basically that how you can constrict the pupil. So suppose this light after synapsing with this lateral geniculate nucleus, some fibers from this optic tract will enter into the midbrain, where you have got some special nucleus for the activation of this third cranial nerve, which help in the constriction of pupil, because we know that third cranial nerve is also parasympathetic, and these third cranial nerve also help in constriction of the pupil. But how this constriction of pupil basically works? So light fibers from the optic tract, some light fibers from the optic tracts will enter to the midbrain. Suppose here we have got this part of our structure is midbrain. As we know, the third and fourth cranial both originate from midbrain, and in midbrain we have got some important nuclei, like one of them is pretactal nucleus. Suppose here we have got pretactal nuclei on the both side, pretactal nucleus, and above pretactal nucleus we have got another nucleus, and this is parasympathetic nucleus of third cranial nerve, and this is called as Edinger-Westphal nucleus. Edinger-Westphal nucleus. So you should understand here now that some light fibers from optic tract before synapsing with lateral geniculate nucleus, some light fibers will enter into the midbrain, and they will synapse with pretactal nucleus. pretactal nucleus. Same on this side also. So remember that these fibers are entering into the midbrain and they are synapsing first with pretactal nucleus. Here is the pretactal nucleus, and if asked in exam that what is location of this pretactal nucleus, so you should understand that location of this pretactal nucleus is your midbrain. So here you can see that these fibers which are coming from your optic tract, these fibers are synapsing with pretactal nucleus of the midbrain. Then these fibers will synapse with Edinger-Westphal nucleus also, and Edinger-Westphal nucleus, this is parasympathetic nucleus of your third cranial nerve. Okay, so fibers from the optic tract, so you can see these light fibers, yes, will enter into the midbrain and they will synapse with pretactal nucleus. So this is pretactal nucleus. I will write here. What is this nucleus? This nucleus is pretactal nucleus. Pretactal nucleus. Pretactal nucleus. Pretactal nucleus in the midbrain, and this red one is Edinger Westphal nucleus. Pretactal nucleus and Edinger Westphal nucleus. Remember these names, please. These are both very important. So okay, so light fibers from the optic tract, without synapsing with lateral geniculate nucleus, some light fibers will enter to the pretactal nucleus, because these are going to manage your basically pupil, and they are going to now activate your third cranial nerve in order to constrict the pupil, especially when you throw bright light or when you illuminate your eyes, your pupil will constrict. And some fibers you see from this optic tract enters the pretactal nucleus of the same side, and same side then they enter into the Edinger-Westphal nucleus. But some fibers, you should understand that some fibers will cross and they will synapse the opposite side Edinger-Westphal nucleus as well. So they will synapse with contralateral Edinger-Westphal nucleus. This is very important information that you should write, that some fibers are synapsing with the ipsilateral and then they move and synapse with the contralateral Edinger-Westphal nucleus also. That's why whenever you are illuminating one eye, you will throw, you can do this, assessment, you can evaluate this, you can perform this kind of exam, that you will illuminate one eye and you will see that other eye pupil will constrict. Why? Because these light fibers, after synapsing with same side pretactal nucleus and Edinger-Westphal, they are crossing and they are synapsing to the opposite side. So you can see these fibers cross here. That's why you can illuminate one eye and you can see that pupil will constrict in both eyes, in opposite eye also. The reason, because these fibers are crossing here in midbrain, in pretactal nucleus and Edinger-Westphal nucleus. And then from this Edinger-Westphal nucleus, we know that third cranial nerve will activate, and third cranial nerve will enter now, and now it's activating your third cranial nerve. Suppose this is cranial nerve number 3, third cranial nerve, and third cranial nerve, this is parasympathetic, and it's going to now synapse with basically which parasympathetic ganglion. So you should remember the name of this ganglion also. This is our ciliary ganglion. This is our ciliary ganglion. Ciliary ganglion. So this is ciliary ganglion. So third cranial nerve, it's innervating the ciliary ganglion, but who is activating this Edinger-Westphal nucleus? These light fibers which are coming from your optic tract. So light fibers activate this nucleus, parasympathetic nucleus of third cranial nerve. Then third cranial nerve, it's synapse with Edinger-Westphal nucleus, and through this like third cranial nerve, it's synapsing with this ciliary ganglion. This is your ciliary ganglion here, ciliary ganglion. You can write here ciliary ganglion, ciliary ganglion. So this is ciliary ganglion here, and then from the ciliary ganglion, fibers of the short ciliary nerve, fibers from short ciliary nerve, fibers from short ciliary nerve suppose this is short ciliary nerve, short ciliary nerve, and short ciliary nerve is innervating muscles here, and these are muscles, intrinsic eye muscles, and these muscles are called as sphincter pupillae muscles. Here we have got sphincter pupillae muscles. So you should remember, this is ciliary ganglion here, this is ciliary ganglion, this is third cranial nerve, and third cranial nerve is originating from parasympathetic nucleus like Edinger-Westphal nucleus. It's innervating ciliary ganglion. From the ciliary ganglion, fibers of this short ciliary nerve, this is short ciliary nerve, short ciliary nerve, this is short ciliary nerve, are going to innervate sphincter pupillae muscle, and sphincter pupillae muscle are those muscles which help in constriction of the pupil. So this is the entire pathway for the pupillary light reflex. Again I will recall, okay, that this is the visual field area of the right eye, this is the visual field area of the left eye. This is suppose your basically temporal visual field area, and this is the nasal visual field area. So you can see that light from the temporal visual field area it enters, and it continues as which part of the retina? The nasal retina. And then this is right optic nerve, this is the left optic nerve, and these nasal retina fibers are crossing each other at the optic chiasma, and then they continues as optic tract in the opposite side. You should understand this. And then optic tract fibers, they synapse with the lateral geniculate nucleus, and then lateral geniculate nucleus fibers continues after synapsing as optic radiation to the visual cortex. So this is visual field area, but some fibers from the optic tract before synapsing with lateral geniculate nucleus will enter into the midbrain. Why in the midbrain? For the accommodation of the lens, for the constriction of the pupil, because constriction of the pupil, this is parasympathetic action. So who is giving this third cranial nerve? Midbrain. Where? Edinger-Westphal nucleus. But where these light fibers of the optic tract will synapse? In the pretectal nucleus of the midbrain. From the pretectal nucleus they synapse with the Edinger-Westphal nucleus. In the same side also, in the opposite side also. Then through the Edinger-Westphal nucleus, these fibers through the third cranial nerve will synapse with the ciliary ganglion. This is the parasympathetic ganglion. From the ciliary ganglion, this information is traveling to the sphincter pupillae muscles, and then these muscles are going to constrict your pupil. This is what happens basically when you throw the light in any eye. You will see that immediately there will be constriction of the pupil, but this happens through this entire tract. So this is called as visual field, or this is also called as pupillary reflex, pupillary reflex pathway. So this is afferent also and efferent. This is ascending also and then descending. So what happens if there will be any injuries, like any injuries in the optic nerve? So suppose one person is having any injury in the optic nerve. So suppose injury in the right optic nerve, so it means there will be complete loss of the vision in the right eye. So that is called as anopia. So that is like anopia. So suppose one person is having injury in the, this is right eye and this is your left eye. So if any injury in the right eye, so person is having complete blindness in the right eye. So this is right anopia. So this is anopia. This is anopia. And if one person is having injury in your this part, like this part, this is part of the optic chiasma. So what will happen? You see, the optic chiasma is the part where, you know, these fibers are going to cross and they enter to the opposite side, but only the nasal fibers. So nasal part of the retina is carrying the light from the temporal area. So that's why people with, you know, optic chiasma lesions, they are having vision loss, but only in the temporal part. So people with the lesion in the optic chiasma, they are having bitemporal hemianopia. Bitemporal hemianopia. Bitemporal, both sided temporal. So this is called as bitemporal hemianopia. Bitemporal hemianopia. Bitemporal hemianopia. And if you will be having any problem in the optic tract, suppose one person is having injury in the optic tract, what will be the clinical presentation? Injury in the optic tract. So you can see in optic tract, the light in the optic tract is coming from the both eyes, from the right eye and from the left eye also. And in right eye, this light is basically in right optic tract, this light is coming from right eye, but which part of the nasal part? You can see that this nasal part, it's coming. Focus on this, you know, green, you know, this neuron, this one. So it's coming from nasal visual field area and it continues as temporal retina and it's enters to the same side, you know, optic tract, it's not crossing. But from the left eye, this light is coming from the temporal part. So it's mean if you will be having injury in the optic tract on the right side, so person will have basically you know, like homonymous hemianopia. This is called as homonymous hemianopia. Homonymous hemianopia, but in the right eye person will have basically defect in the nasal part, in nasal retina. And in the left eye, you see this, you know, in right optic tract, this, you know, fiber is coming from basically which part of, you know, optic nerve from the left eye? Temporal part. So it's mean that in left eye problem will be in temporal region. So you should understand this is called as homonymous hemianopia in case of injury to the optic tract. Optic tract. Anopia in case of complete blindness of the optic nerve. Bitemporal hemianopia in case of injury to the optic chiasma. Optic tract, you can see homonymous hemianopia. And then if you have got injury in optic radiation, so what will happen in case of any injury to the optic radiation? In case of optic radiation, there will be quadrant anopia. Quadrant anopia, if there will be injury in the parietal lobe, there will be inferior quadrant anopia. If temporal lobe, there will be superior quadrant anopia. So you should remember like PITS, like parietal, inferior, temporal, superior. So quadrant anopia in case of injury to the optic radiation. Homonymous hemianopia in case of injury to the optic tract. Bitemporal hemianopia in case of injury to the optic chiasma. Anopia are the complete blindness of one eye in case of injury to the optic nerve. So you should draw this, watch this lecture again and again, recall this, then you will be having a clear concept about the visual field, about the light reflex. I hope you understood. Till next video lecture, take care. Thank you for your consideration.